Some of the things that we learned for reducing the risk of suicide is making it very easy and simple for any healthcare provider, but also just to make it really easy to have that conversation, to discuss the risk of owning a firearm, especially for our mental health patients when they're embarking on a new treatment for their mental health concern.
I remember as a parent when our kids were little and, mass shootings in schools were just beginning. I felt uneasy when my kids were headed off to school because I thought, wow, I never even considered that as a possibility.
And I would say the answer to the question, why should health professionals get involved, is the same as the answer to the question, why is violence a public health problem? People are dying from it.
Hello and welcome to the Permanente Medicine Podcast. I'm Chris Grant, your host and Chief Operating Officer of the Permanente Federation. Incidents of gun violence throughout the United States are dominating news headlines in recent years, and our nation now finds itself in an unfortunate reality where shootings are all too common occurrence. On this episode of the podcast, we'll shed more light on the topic of gun violence and the role the medical community plays in addressing this public health crisis. Our guests today bring valuable perspective on firearm safety, violence prevention, and the mental health components at play with this complex issue. Joining me is Dr. Pavan Somusetty, a psychiatrist specializing in suicide prevention and Chief of Mental Health for Northwest Permanente. In his role, he has advised Kaiser Permanente's Firearm Injury Prevention Task Force on strategies for suicide prevention related to safe firearm storage. Also joining me is Dr. Garen Wintemute, Director of the Violence Prevention Research Program at UC Davis. Dr. Wintemute is a renowned expert in the public health crisis of gun violence and a leading authority in the field of injury epidemiology and prevention of firearm violence. Thank you both for joining me today on the show. Pavan and Garen, I'm really thrilled to have you here for this incredibly important and really complex conversation.
Thanks for having me.
It's a pleasure to be here. Thanks, Chris.
All right, well, let's get started. I'd like it if you could each tell our listeners a bit more about your work and the unique lens in which you view today's topic of gun violence and public health. Each of your specialties are so valuable for offering perspective and insight on the issue. Pavan, let's get started with you.
Sure, Chris. As you noted, I'm an adult psychiatrist. I'm based out of Portland, Oregon, and I've been practicing for almost 13 years here in Kaiser Permanente. And as a psychiatrist, I've always been struck by the impacts of suicide, both on families and on the clinicians who treat our highest risk patients. And this has a lot to do with my own experience, seeing people struggle with suicidal thoughts in my circle, in my family and friends, but also losing patients, which is just devastating. About 5 or 6 years ago, I came across the zero suicide movement that was started at Henry Ford and was just fascinated by how health systems were treating suicide prevention as a patient safety issue, making it simpler on team members to be very consistent with screening and treating at-risk patients, almost in a checklist fashion, like they do in the emergency room or the ICU when they come in with, in shock. One of the simplest things we saw that was effective was discussing safe storage of firearms with our patients, both when they're suicidal, but also earlier in their treatment journey. And those learnings were very applicable to our partners when talking about violence risk or violence prevention.
It seems so logical. I mean, we have safety caps on pharmaceuticals and prevention around, how you store prescription medicine at home, that it just seems so overdue to have, safe gun storage as a logical topic in a health environment. Garen, let's hear from you.
Well, like Pavan, I came into this work out of my clinical experience. I'm an ER doc, and 40 years ago at the start of my career, got interested in intervening upstream in that flow of events that brings people through the doors of the emergency department. It was true then, and it's true today, that the vast majority of people who die from gunshot wounds die where they're shot. Good care in the emergency department, in the resus bay, in the operating room is irrelevant to them. If we as clinicians want to make maximum inroads into death from firearm violence, we need to prevent people from being shot in the first place.
And, everything we do in healthcare, right, starts with prevention. And so applying that to gun safety makes complete sense to me. We've seen some really concerning trends around gun violence throughout the United States in recent years. According to Pew Research, more than 45,000 total gun deaths occurred in our country in 2020, the most on record. This represents a staggering 25% increase from just 5 years earlier and a 43% increase from a prior decade. What could be the reason for this rise in gun violence, and why do you think the medical community needs to address this trend? Garen, let's hear from you first on this one.
Sure. The situation has gotten even worse. There was a further 8% increase in firearm-related deaths in 2021. 2022 probably represents an increase over 21. We're waiting for the data. But this might be the year when we break 50,000 deaths from firearms. Firearms are the leading cause of death in childhood now. We are the only country on the planet for which that is true. And I would say the answer to the question, why should health professionals get involved, is the same as the answer to the question, why is violence a public health problem? People are dying from it. It's just that simple. We face the same mandate to prevent death from firearm violence that we face to prevent death from cancer or heart disease or any of the other health problems. If it kills people, it's a health problem.
Simply put, that's so right. And you think about all the resources and energy that we do put into preventing heart disease or cardiovascular health. It makes total sense to make those same investments in planning for prevention of firearm tragedies. We've seen an influx in the number of mass shootings taking place over the last few years. Just this January, we saw terrible acts of violence with a teacher getting shot by her 6-year-old student at a Virginia elementary school. And then just days later, the mass shooting in Monterey Park, California during Lunar New Year celebration. How has the American healthcare system responded to these tragedies? And what has been the impact you've seen in your area of expertise? Let's start with Pavan and then go to Garen for this one.
Yeah. In the healthcare field, what I've been seeing are podcasts like this, but really a renewed call for leadership, especially from physicians, given that the victims are seen in our emergency rooms. They're in our hospitals. Who else but us to really lead sort of any sort of change on this? And then more specifically in the mental health field, we're seeing patients and families experience trauma directly from exposure to these events, but also anxiety in the communities. Imagine if you were a parent of another kid in that classroom, how would you feel about dropping your child off at that school? But even with the 24-hour news cycle, we see anxiety in new parents across the country. Even if the gun violence didn't happen in their immediate community, they're worried, they're anxious, and we're trying to treat them. The other impact we see is on healthcare providers themselves. We've seen a lot of fatigue within healthcare providers and seeing these same incidents happen over and over again, but also their own sense of safety. We've seen violence happen in hospital settings and in clinic settings. And so that's the other concern I have is of medical providers leaving the industry. It's difficult to feel safe during these times.
I couldn't agree more. Gun violence has such a traumatic effect, not just on the victims, but on the families, on the coworkers, on the students that last lifetime and have extraordinary health impacts. So focusing on prevention makes just a ton of sense. Garen, be really interested in your insight.
Clinically, I think experience in emergency medicine mirrors what Pavan has just been talking about. But this is our lane. To those listeners who might have doubts, the first thing that we see is grief and the emotions that flow from grief. And part of our mission as healers is to help people cope with the grief, the suffering that follows an event like this that, as you've said, Chris, doesn't just affect the people directly involved. The circles now ripple out to all of those who watch the videos on social media and are vicariously participating in mass shootings every week. And we're coming to recognize the long-term costs that we are paying as a society for that continuing sort of exposure. But we also help people try and make sense out of this seemingly uninterpretable, not ununderstandable events, to help people understand there is a science to this. There is an epidemiology to mass shootings, as there is to cancer, that while a given shooting in a given place at a given time might not have been predicted, we can see the factors that cause such tragedies to occur in general. And we help the public and we help each other as professionals come up with plans for action so that we can reduce the toll of these events in the future.
Garen, I love the fact that you are applying data and science to gun safety and gun violence. And because we need to use epidemiology and kind of traditional medical practice thinking and science in the application of preventing and really kind of addressing and isolating the root causes. It's one of the reasons I'm so proud of Kaiser Permanente and our recent $25 million commitment to gun safety research, because better understanding this with the same level of focus that we apply to cancer or heart disease is really quite critical. And the many, many, many community members, family members, loved ones that are also affected. Pavan, mental health is such a critical component to this conversation about gun violence and firearm safety. Can you tell us about some of the key initiatives taking place in the mental health community around addressing gun violence and how you see this evolving in the coming months and the coming years?
Yeah, so as a psychiatrist, what I see more is suicide. So that's the gun violence that we see. I'm not as much of an expert on violence risk, but some of the same strategies that we use can help when we encounter patients that may be at risk of harm to others. So I just wanted to make that more clear. And we're definitely wanting and anxiously awaiting more data on violence risk and how to predict that risk for patients or of patients, and really to make it easier for healthcare providers to identify violence risk in our patients. Because I think we actually do a pretty good job with suicide, believe it or not. There are known risk factors, and we make it simple. And that's one of the findings that we've come across in healthcare, is that we can identify patients at risk of suicide. Can we use similar learnings or make it really easy for clinicians to figure that out for violence risk? But some of the things that we learned for reducing the risk of suicide is making it very easy and simple for any healthcare provider, but also just to make it really easy to have that conversation, to discuss the risk of owning a firearm, especially for our mental health patients when they're embarking on a new treatment for their mental health concerns. So sometimes starting a new medication or therapy can cause people to feel initially worse before they feel better. So sometimes discussing trauma for the first time can increase their anxiety. Substance use, we should not forget about substance use. Someone who makes the decision to stop using a substance might have this brief relapse on their road to recovery and might feel some guilt or shame about that, or somebody who's been sober for a long time and then they relapse can have some guilt or shame around that as well and cause them to feel suicidal. And so in all these examples, as a mental health care provider, we can identify when those patients are at risk, can discuss their access to firearms, how to safely store or remove their weapons. What we always find is it's always better to educate our patients about the risk even before they experience suicidal ideation. So if we wait until they're suicidal, that becomes a lot harder. But talking about it beforehand, finding out if they, what do they have in their home, how is it stored in an open, non-judgmental fashion is really key.
Yeah, thanks so much, Pavan. And Garen, you're a pioneer in your field of injury epidemiology and prevention. What are some insights you can share about the underlying causes that contribute to firearm violence from your years of research on this topic? And what are some steps we can take to break the cycle?
So I'll take an emphasis on interpersonal violence to complement Pavan's emphasis on suicide. As he mentioned, both at the individual and population level, many of the risk factors are similar. So interventions on one can prevent the other. Maleness, oh, by the way, let's mention, but also a prior history of violence, a history of substance use, a history of loss, more broadly, a sense of having no place in or future in our society are risk factors at the individual level. Another one measured both at the individual and at the population level with quite consistent findings is ease of access to firearms. And again, that's true at the household level, where bringing a firearm into the home is associated with a dramatic increase in risk for both homicide and suicide, which is not limited to the owner of the firearm. At the population level, the prevalence of ownership is related to rates of both homicide and suicide. But the other thing that we've learned is that setting limits on access to firearms is effective, particularly at times like this. There's a tendency to say, gun control laws don't work. We're still having mass shootings. But to use California as an example, where I am, we have relatively to the rest of the United States, not relative to other countries like ours, pretty robust regulatory approach to firearms. Our firearm homicide rate is well below the average for the United States. Our firearm suicide rate is among the lowest in the country. And I'll quantify. If the rest of the country in 2020 had California's firearm death rate, we would have saved 15,000 lives. There are states that have lower rates than we do, and every single one of those states, like us, has a robust regulatory approach to firearms. So the contention that policy doesn't help simply doesn't bear up against the evidence.
I'd like to just add on as well. I mean, just from a very simplistic way to look at it, it's a lot easier to get access to a firearm than it is to get mental health care or addiction care. There's a lot of hoops people have to go through. But if you're struggling, what's the easiest thing to get access to in that moment, right?
Yeah, it is one of the sad realities. And I think, you're both making a great point that states like California don't have a prohibition, but just have additional steps and some limitations in order to pre-screen and to kind of have certain guns that are more controlled, but by no means a prohibition from gun ownership. So there are tools in place in states that have had success in saving lives and saving tragedies while still allowing for civil liberties. In 2022, a 5-month pilot program conducted within our Permanente medical groups and through our pediatricians at our Kaiser Permanente San Diego Medical Center showed clinicians can have positive, productive gun safety conversations with patients, with parents of patients at the point of care. What are some strategies physicians and clinicians can use to effectively lead conversations with families about gun safety? I'd like to hear both of your perspectives. Dr. Somusetty, why don't we start with you?
Yeah, so that was an exciting project. And I know the team reviewed Dr. Wintemute's work along with other research. So I'm actually kind of a fanboy to be here at the same phone call with you. But I think what you should know before I kind of talk about what they did was they spent a considerable time talking to our members, the public, especially leaning into talking to people who have very strong feelings about their constitutional right to own firearms and recognizing, I think one of the major findings was that they care about the safety of their children as well. We found some commonalities in everybody that they spoke to. And so I think the findings of it became less sort of divisive and just providing really easy talking points for our pediatrician. But what they found to be most effective was just normalizing the conversations. So just like pediatricians asking about the swimming pool or the car seat, how are those secured when, are your children using the car seats? It's the same type of conversation. We're just really focused on the children's safety. Everyone can agree on that. And the pediatricians were trained to not pressure or push parents into these conversations if they weren't interested, but just leaving the door open for future conversation.
Yeah, that's great insight. Dr. Wintemute, I'm really interested in your thoughts on effectively lead these conversations with families.
Sure. The situation varies from one specialty to another, but we did some survey research and found that patients are happy to talk with doctors about firearms and firearm-related behavior as long as two conditions are met. One, the conversation is relevant, and two, the doctor knows what she or he is talking about. So you have to bone up. But that we did that for COVID, it's part of the job. Here's how I have that conversation. As an ER doc, something about the visit, something about the history has established in my mind a risk for violence, either at the moment or in the near term. And I make that part of the conversation and then say, I'm always concerned about safety. And at times like this, I ask some other questions about guns and things like that might have to do with safety because I'm a little concerned. So tell me, are there any guns at home? Or words close to that. I've done a couple of things, and I'm shortcutting here, but I've established, hopefully to the patient's satisfaction, the relevance of the topic to the visit so that they don't think I'm wasting their time. But the other thing I did is I used the word guns about 10 seconds before I asked the question, which allows that, he's going to ask me about guns defensive reaction to come and go before I actually ask the question. And the other thing I do, and I know we're just on radio here, there's no visual, but in the ED, I'm usually sitting en face with the patient in a sort of confronting position. If it's at all possible, I physically move so that I am literally sitting at the patient's side. So we are on the same side looking at the question together. And then I ask them about guns. And, as Pavan mentioned, I'm an ER doc, I don't have the luxury of a repeat visit. If the door opens, then I walk through it. If the patient says, "Get out of my business, doctor," I get out of their business because we've got other things to do, both of us, but I've planted the seed, and maybe next time somebody will find the door more open.
And I love the fact that you're meeting the patient where they are, giving them kind of a rationale for the conversation, and then, physically being on the same side with them. This is such an incredibly challenging topic. And I'm sure many people are feeling uncertain and even scared about the direction our country is going when it comes to gun violence. I remember as a parent when our kids were little and, mass shootings in schools were just beginning, I felt uneasy when my kids were headed off to school because I thought, wow, I never even considered that as a possibility. But the fact that it happened in a school that isn't dissimilar to my own children means it is possible. I really want to end on an optimistic note. And I think you have both opened the door that engaging in conversation, removing the stigma around this topic, and utilizing, evidence and science and applying it in the same way that we do, other areas of healthcare that we're working hard to treat and save lives makes a ton of sense. So on a upbeat note, could you each share one or two things that are giving you hope in your work when it comes to how we're addressing gun violence and firearm safety? Garen, let's start with you on this one, and then we'll finish with Pavan.
Sure. For a very long time, I've gotten the question, is this the time, and we're in a time of tragedy now, when Congress will do something, when legislators will do something, when somebody else will do something? And my response for a very long time has been, if we all wait for somebody else to do something, nobody will do anything. And that's grounds for despair. So it's time to step up. And what gives me hope is that unlike any time in the last 40 years, people are stepping up. Health professionals are saying, this is my lane. I need to make this part of my practice. Members of the public are saying, if I hear a threat, I'm going to convey it so that a gun violence restraining order can be issued. People are starting to recognize that there's only so much you can do about firearm violence if you only focus on guns. That we have to be willing to look at the social determinants, as they're called, of risk for violence. And that sort of awareness is growing very rapidly. And I am, to be quite honest, more optimistic about the future for firearm violence prevention than I have been ever.
That says a lot. Listening to you today gives me a lot of hope as well, because I think we're now starting to get to some of the heart of the challenge and the application of some tools that can meaningfully help. Pavan, I'd love your guidance and your insight.
Yeah, since the pandemic has started, it's shown a bright light on mental health. And it's exciting now that so many are reaching out for helping themselves and their family earlier in their mental health or substance use journey. And we have so many opportunities to have really just straightforward conversations to educate our patient about their risk and to discuss safe storage of firearms. And really, I think that's where I take hope in, is there are so many opportunities, easy opportunities, that we don't have to wait for somebody else to do something. Everyone in the healthcare field can make an impact through their lane, through their interactions with patients. So that's really exciting to me.
And I have a lot of hope as well for the future. I think that sometimes the worst tragedies bring the greatest hope because it affords action on many fronts. And I love the wisdom that you provide about it starts with each one of us. And if each one of us takes responsibility to engage, to have the conversation, to build it into a standard patient visit, to support research around gun safety, all of it makes a difference. It may be incremental, but this relentless pursuit of incremental change in time becomes transformational. And I'm hopeful that this podcast also informs many of our listeners and motivates them to engage and to understand. This has been such an important topic and one that hits home for so many people. You're each doing vital work to help, and I feel really hopeful after this interview that positive change is on the horizon when it comes to addressing gun violence in our communities. Thank you so much for joining the podcast today. Pavan and Garen, it's been a real privilege to have you on the show and to spend time with you.
Thanks for having us, Chris.
Yeah, really appreciate it.
And thank you once again to our listeners for tuning in. We hope today's episode was helpful and informative, and you'll take the time to subscribe or share a review. We'll see you next time. The opinions expressed on this podcast are those of the speakers and are not necessarily the views of Kaiser Permanente, the Permanente Medical Groups, or the Permanente Federation.